My name is Megan.
And my name is Jennifer.
And we are both physical therapists certified in pelvic floor rehabilitation. We are here today to discuss with you more about the pelvic floor.
The pelvic floor consists of nerves, fascia, and 3 layers of muscle that go from the pubic bone to the coccyx or your tailbone in a sling-like format. Some of the key functions of the pelvic floor include supporting the abdominal and pelvic organs, sphincter control for continence of bladder and bowel, assisting with sexual function as it's responsible for items such as pleasurable intercourse and achieving orgasm and/or erection. For core stability, the pelvic floor assists with strength, control, and coordination of the low back, pelvic girdle, and hip, and it acts as a sump pump to help move blood and lymph fluid back towards the heart.
The core functions as a piston system, working together with the diaphragm, the lumbar multifidi or the deep low back musculature, and the transverse abdominis, your deep abdominals. Although strength of individual muscles is important, the coordination and timing of the system as a whole, along with the communication to the brain, is the key in the fight against urinary incontinence.
You may place an exercise ball or rolled towel underneath the pelvic floor or perineum, which is the area between the anus and the vagina, to help assist you with some feedback. Ensure you maintain 3 points of contact: the right sit bone, the left sit bone, and the perineum, rather than the right sit bone, the left sit bone, and the tailbone. This may mean that you have a slight curve in your low back. Place one hand on the side of your ribs and one hand on your belly. As you inhale, you're going to think about inhaling through your nose, aiming for a full 6 seconds. Feel the belly expand out and the ribs move laterally. Envision the sit bone separating as you fill with air. Understand your pelvic floor is expanding to match the diaphragmatic descent. You should not be actively contracting during this time. As you exhale, air should leave your mouth for a duration of 10 seconds. Feel the rib cage soften and the belly draw in. The pelvic floor is gently lifting as the core is engaging.
Your chest should and will move, but it should not dominate the pattern, like when you are short of breath. This causes us to suck our belly in, opposite of our end goal. The shoulders, they should remain fairly quiet throughout the breathing cycle. Envision an umbrella opening. We want your breath to open up 360 degrees around the midsection. To activate your pelvic floor muscles, you may use one of the following cues. Pretend to stop the flow of urine, or pretend to pull up and in a tampon. Pretend to stop the release of gas. Or lastly, pretend to lift up your perineum toward your head.
As you practice, you should feel your pelvic floor muscles pull in and up. As you work on your pelvic floor contraction, you will want to try and think about: first, using your breath cycle to your advantage. Coordinate your pelvic floor contraction with your exhale, as we have just learned. Lastly, but certainly not least, ensure you're not holding your breath. Make sure to avoid using your legs, buttocks, or stomach muscles, as these are compensations of the superficial muscle system. No one should be able to tell that you are performing a pelvic floor contraction by looking at you. If they can, you are likely using the superficial muscle system, and we want to target the deep system. Do not practice by stopping the flow of urine while you are on the toilet. This may prevent complete emptying of your bladder and promote the opposite of what we are trying to accomplish in function.
Now that you have learned what the pelvic floor is, what its functions are, and how to locate your deep muscle system, it's time to treat it.